Hi, everybody. Welcome to Topics in NeuroRehabilitation presented by ReWalk Robotics. This week, we're going to talk about what you as clinicians can do to get your patients with spinal cord injury ready to have their best possible experience trialing a personal use exoskeleton, such as our ReWalk P6.0 device. We'll be doing things a bit differently this week by chatting directly with a member of our ReWalk team, Matt Fuller. Matt has worked with ReWalk Robotics since the summer of 2017 as both a clinical training and business development manager. So he blends sales and rehab knowledge to bring a unique perspective and experience to the clinicians and patients that he works with. He feels that creativity and outside of the box thinking are what help our patients to achieve their unique goals and believes that technology can make these things even more attainable. Matt has enjoyed working with a wide range of patients, including athletes and amputees, as well as patients with various neurologic conditions. He was even asked to present at a TEDx event in the fall of 2018, describing his experiences with exoskeletons and spinal cord injuries. So be sure to check that out as well. We're going to jump right in here. So tell us a little bit about your early career and any thoughts or preconceptions that you may have had about working with rehab technology.
Man, the preconceptions were many. I think the best of my knowledge and remembrance of dating back all the way to even PT school was modalities class, and just thinking how silly it was that we'd use all these different technologies to help patients when, I went to University of St. Augustine, which is a manual therapy school. So we were doing a lot of hands-on work, and I just thought, why would I use a piece of technology when I could use my hands to hopefully create an even more specialized and specific treatment for that patient, instead of using what I thought was technology was kind of like a cookie cutter approach, a catch-all modality to just make patients happy. But that preconception was actually changed early on. I started working at a small outpatient rehab facility in Phoenix, Arizona called Touchstone Rehab. And there I was kind of just thrown right into all sorts of different advanced technologies, like prosthetics, microprocessor knees, worked a lot with those, worked with some robotic arms, people that had actually their arm amputated and they were using a robotic arm for daily tasks. And then also ReWalk Robotics, I was introduced to it there. But even at that moment, I thought technology was cool. It was helping these people, but maybe that this was just something that PTs were introduced to. I was really looking at it on a surface level, you know what I mean? There's oh, this is cool, it's helping them, but I didn't really think how or why it was helping them. So once I did start working with ReWalk as a clinical training manager, I was, I think early on, intimidated by how involved the technology was and how much I didn't realize was going on while someone was using the device.
Yeah, absolutely. I don't think you're alone in that one. But so now that you're about 3 years under your belt of working directly with these patients and the ReWalk personal exoskeleton device, tell us a little bit about what it is that you look for when considering if a patient is going to be a good candidate to try this technology or maybe not.
There's the basics that we look for when we go through the screening process, just based on their level of injury, their length of injury, like how long ago were they injured. And you can create a lot of judgment through that. But what I've learned countless times is don't judge someone based on those statistics or just the label of their injury or how old they are. Don't really want to base it on that alone. So what I'm really looking for when I first see someone is, are they sitting up straight? Are they excited to try the device? Either if I'm on the phone or seeing them for the first time in person, are they excited to use it? Are they anxious? Are they nervous? I think nervousness and anxiousness is normal. But I really think if someone already has an idea of how they would use it, that helps them see the bigger picture outside of just like a one-time trial. But physically, I really want to see someone be able to transfer on their own. That helps a lot, because people that can transfer on their own are more aware of their body and how they're moving and where they are in space, rather than needing assistance with their transfers, you know. And now that, like, I've been doing this for 3 years, training clinicians for 3 years, I've kind of had to always go back to the basics, because the basics are so the foundation of how this device works. Like, the basics aren't the fun thing, but the basics, just like anything else, are super important. So making sure the range of motion is adequate, and checking that range of motion not only on a table, but getting them in a standing frame and seeing how they tolerate being upright. And, you know, most standing frames have that chest plate that patients tend to lean on. And when they're used to using that, they're still flexing through their hip flexors, most likely. Like, they go from a chair where they're seated with flexed hip flexors, and they go to standing, and they're standing with flexed hip flexors. So I really like to see people, they don't have to be able to hold themselves up, but be able to not have that chest plate in front of them and really extend into a tall standing position.
Excellent point. And then go ahead and get a little bit more into the specifics of the ranges of motion that you're looking to see with these patients.
You know, basically, if someone can lay flat on a bed, have a, you know, do an Thomas test, their leg lie flat, or prone even is even better. And what prone can do also is show you their ability to use some back extension instead of just relying on the table laying supine. So if they're prone and they can lift their chest up, that's going to show a lot. So really, hip extension neutral, knees definitely at neutral. You know, there can be some tolerance and there's adjustments within the device, but I think if we're speaking about how do we get someone to be the best version of themselves, to have a good first session, would be to make sure that they have pretty much neutral hip, knee, and ankle in standing, and not just on the table.
Excellent point. Okay, well, now that you've given us a really good idea of what it is you're looking for someone you'd consider an ideal candidate to trial this technology, we all know that not every patient that we come across would be labeled as that ideal patient. So walk us through a plan that therapists could use to help get someone who maybe is almost ready, or maybe just not quite at that point where we call them the ideal. What would you recommend therapists and patients be working on prior to that trial?
You know, that's a great question. That's something that I have been trying to implement more into my training when I'm training clinicians, and then also just really trying to advocate for working with someone prior to getting in the device, rather than evaluating them and then saying, okay, the range of motion is good or good enough, and then we'll just see how it goes on the clinic day. So ideally, I would have you, say you're the ReWalk therapist that I'm working with, I would have you evaluate the patient 6 weeks prior, which will give us 6 weeks of lead time to get them ReWalk ready. So I would break this up into probably 2 phases. So 2 3-week phases. So the ideal candidate, you know, independent transfer, standing tolerant, like everything's great. That's almost never the case. So early on, I would be really practicing on that transfer skills in the clinic, talking about that head to hip relationship, working from a low service to a high service, because when you do transfer into the ReWalk, you do kind of have to bump over the side of the leg. So getting someone confident with that type of transfer. And then starting to slowly introduce just static standing tolerance in the clinic, whether that's using a standing frame from most supportive standing to standing parallel bars with knees locked out, using KFOs if they have them, just whatever you can do to be creative to kind of go from a super stable static standing to a less stable static standing in those first 3 weeks. And then while the patient's at home, really focusing on improving their range of motion at their hip, knee, and ankle joint. They can do that by laying prone in cobra for their hips, and passively pushing themselves with their arms into more extension through their hips and their back. If they're long seated on their bed, they can use a towel around the foot and pull their ankle into dorsiflexion, which will also help stretch that knee extension as well. If they're limited more in the knee than the ankle, you're going to have to work on the knee a little more, maybe passively pushing their knee into more extension while they're long sitting. But long sitting and prone are probably the two positions I'd be working on at home.
Okay.
And then the second 3 weeks is going to be kind of building on those foundations. I've used that a lot, which is foundational work, and then continue to build from there. So adding strength and dynamic components. So in the clinic, I'd be doing almost all activities in standing. And that can include adding just reaches in all directions, getting someone used to kind of reaching outside of their balance support and returning, because that happens a lot when you're walking with the ReWalk. Adding weights, you could be doing any kind of strengthening exercises while standing. And then resistance band rows. Really, if you're a therapist, you're going to have a whole toolbox of exercises you're doing to work on all these sorts of things, but just really trying to think more about the function of standing and walking and how you can progress to that moment, in this 6 weeks. When the patient's at home, and if the patient doesn't have a standing frame or someone at home with them all the time, continuing to progress the seated trunk exercises and expand them at home. So seated on maybe a less stable surface like a bed, if they can tolerate, if they're really good at seated on like a chair or in their wheelchair without support, progressing there. And then also including some of those reaches, giving them an exercise band to continue to work on back strength and scapular control. And then really specifically focusing on the cobra pose, but instead of using that passive push, having them either push themselves into their end range of extension and then lifting their hands to hold that position and hold it as long as they can. So that would probably be, the basics of a great prehab program. I think if everyone did that before they used a ReWalk for the first time, their experience would be light years better. We see patients that I've seen high level triathletes, and I've seen low level, people that just have been in their chair for many years and haven't been to physical therapy in a while. So really, I think the take home message here is use the ReWalk as more of a opportunity to impact someone's life more than just getting them ready for the device, because sometimes that ReWalk is going to be their only really motivation to get into the clinic. So take advantage of that and start working on some of those basic skills.
Awesome. All really great points, Matt. Super helpful. Any final thoughts before signing off for today?
Yeah, I just want to highlight like the idea of prehab for this device, and just it's kind of an all-encompassing idea of like technology in general. Like, for instance, like I went from thinking, oh, that's cool, it's just going to take someone and walk them down the hallway, to realizing how involved this technology can be and really looking at it as a tool to enhance someone's life. So we need to make sure that they're prepped and ready to do that. So kind of shifting the thought of like the technology as being something that's doing something for them. It's really preparing the person to be able to utilize the technology in a way that's going to help them.
Awesome. Love it. Thanks so much, Matt. Tons of great information there. And to all of our viewers, thank you so much for stopping by. Make sure you let us know what you think, or if you have any additional ideas down in the comments below. Go ahead and check in on all of our past episodes if you haven't done that already. A lot of great info from the weeks past. And as always, make sure you stop back in next week to see what we have for you then. Have a great week, everyone. Bye.